Today, a great example of looking good in your middle age. Hi guys, welcome back to the channel. My name's Dr Sarah Tonks. I'm a cosmetic physician in London. I've got another great example for you today of a woman who's kind of in her mid-40s, who's never really had much of anything done before, and is just feeling, well, you know, like she would like to try something. So you know me by now, I'm going to be doing a whole host of combination different fillers. We're going to be putting some Botox in there. She's also going to be having some PRP as well around the eyes. So we're really mixing everything together in order to get her a nice result. So let's go over to the patient and do her assessment. So the first thing that really strikes me here is this very, very strong chin crease, very strong. And you can see that this is making her lower facial third look really short. Look at the size of that, it's tiny. And on a female, of course, you can have a shorter lower facial third, but you know, let's not be too crazy here, guys. It can't be too short. The second thing which I see is the eye area. So you can really see that there's some crepey skin in the under eye region, and then we do have this tiny bit of hanging skin. The second thing that draws my attention, guys, is the crepey skin around the eyes, plus this overhanging bit of skin in the upper eyelid. Now, it's not the easiest thing to do in the world to improve this crepey skin, but bravely, I will have a go. The upper eyelid skin, very tricky because you're kind of restricted with how much lift you can get using just toxin. It may be more appropriate for her to go and have a blepharoplasty. I know there's a bit of a trend right now to have plasma, and by plasma I don't mean platelet-rich plasma, I mean energy-based devices which turn the tissue, which is treated, into the fourth state of matter, so into plasma. Sorry to get, you know, slightly technical there. But the downtime with that, it can be quite significant. I'm talking, you know, several months worth of redness post-procedure, not to mention the initial post-procedure phase where you kind of look like you're wearing a Halloween mask. And I think certainly what I practice, people just don't want that kind of downtime, which is why by the way, I don't really like doing threads. It's because of the amount of downtime that they give. Personally, I would rather send her off to have a blepharoplasty rather than messing around and maybe trying to do a bit of plasma or other skin tightening methods for her. I also noticed that there's some dimpling in the chin, so her mentalis muscle is very, very active. And of course she's got this little glabella crease here. You see as well how this eyebrow is slightly more peaked than the other one is. And of course, guys, you know that all this stuff is stuff that we can improve on. So let's talk about how it was done. First things first, I'm going to take some blood for the PRP. I'm using the same kit that I used a couple of weeks ago in a lady who actually looked very similar. So I'm taking 15 mils of blood in order to get around 6 mils of platelet conditioned plasma back. Then I'm going to do the Botox in the forehead and the frown lines, around the eye, the mentalis and the DAO. Remember, she's got this very, very strong downwards pull, which I'm trying to modulate. Now I'm going to use some TSL Ultra Deep in the temples. I'm doing 1 mil per side. The temples for me are often an undertreated area. This is often because it takes quite a lot of product to get a good result here, and it's expensive to do that. I'm using TSL Ultimate along the cheekbone, 1 mil per side, and also the front part of the cheek. Now we're up to 4 mils. Let's have a look. Okay, so far so good. You can see that the cheekbone area and the temple is now a lot more congruent. Notice how the area underneath the eye already looks slightly different. It's possibly through a bit of muscle modulation as a result of having the injections in the temple and along the cheekbone. See how the face has changed into much more of a V shape already. Now I'm using a cannula to the horizontal chin crease and the marionette lines 1.5 mils per side, and switching to voluma underneath the chin to try and lengthen the chin, and then across the chin crease again with a needle. So switching from using a cannula to a needle. And that's because, you know, you're not going to have one tool which will solve every problem. So this is now us up at 8 mils. You can see that the point of the chin is a lot stronger now, possibly a little bit too pointy, but she's swollen here. And already that orange peel dimpling on the chin has improved, and that's because we've broken the connection between the skin and the muscle by putting a thin sheet of filler there. So now I'm going to use Juvederm Volbella and do some very tiny injections all the way along the margin of the lip, concentrating mostly on the lower middle third. So she does have some pre-existing asymmetry in the lips. That's not something that I'm able to completely correct using this technique. However, the idea is to build the groundwork so that at least the next time when that comes, I can do a slightly different technique, which is more for correcting the asymmetry. Then I'm using TSL Ultimate. Lots of tiny little injections in front of the ear. We're doing 0.5 ml per side. Heading back to the chin with TSL Ultra Deep, I'm doing an injection from the angle of the jaw to the chin point using a mil. It's the same entry point as before, because I'm really trying to get a lot more strength and definition there. So in total, we've used 12 mils. So let's take a look at how that looks. Sure, she's a little bit swollen, and yeah, the chin point is possibly a little bit overemphasized, but again, that will settle when the swelling settles down. The last thing is finishing up with this PRP around the eye using a cannula. Now remember, with this technique, you're going to be swollen for maybe 1 to 3 days afterwards, and that's normal. It's because I'm really focusing an awful lot on getting the PRP into where it's really needed. So she goes away, she comes back 3 weeks later. Let's have a look at her pictures. Well, the good news is the eyebrows do seem to have equalized quite nicely, so I'm very happy about that. The crepey skin around the eyes looks a lot better. Combination of using the toxin and the PRP around the eyes. The creasing on the upper eyelid may be very slightly better. It wasn't really the main aim of treatment, but if you do get a little bit of lift in the brow, maybe by a millimeter or two, of course it will release some of the weight on the lid. So it wasn't a planned result, but I think it does look a little bit better. We've definitely got more fullness in the cheek area here. I think for the future, I might go back in and do some work around this part of the eye. I like the lips. They definitely look a lot more hydrated. And the lower facial third is now looking a lot more in proportion, which I'm very happy about. Now, do you remember, guys, the chin was kind of quite pronounced, quite swollen immediately after the treatment, and that's totally normal. So you can see that sometimes it does just take a bit of time for everything to settle down, and it's not going to look 100% as soon as you've had the treatment. It's normal. So don't feel like you need to rush back to your injector just because you've got a bit of swelling or a little bit of asymmetry, because you'll often see that one part of the face will maybe swell up more than its neighboring parts, and it's not something to be worried about. You really just have to wait until all that swelling has gone down before you reconnect with whoever did your injections for you. Otherwise, there's no point in you going back any sooner. And there's not really very much that you can do to reduce the swelling more quickly. It just takes, it takes what it takes. Sometimes we have to be patient. Okay guys, so that's it for this week. I hope you enjoyed the video. For a bit of fun, if you would like me to ask this patient if she'd be willing to have around her eye treated, let's see if we can get 250 likes on this video. What do you say, huh? If I do, I'll get in touch with her and see whether or not she's up for it. In the meantime, Please subscribe to the channel if you haven't done already. And I already asked you to like the video, so do it twice. I'll see you again next week. Bye.